All right, looks like we're recording. Hi, everybody. My name is John Martin. I'm a trial lawyer with the KJC Law Firm here in Boston in Worcester. And with me is Jill Benizio, who is a registered nurse working at a Boston hospital that we're not going to name. Hi, Jill.
Hi, how are you?
Good. How are you?
Good, thank you.
So tell us, what do you do for work?
So I am a travel nurse. I work for a company called Smarter Healthcare Partners, and I am traveling in Boston right now as a float pool nurse.
Okay, what is a float pool nurse?
So a float pool nurse is a nurse that floats to all of the floors. I go to the med surg floor, the cardiac floors, surgical floors. I just don't go to like the OR, the ER, or the ICU.
Okay, and what type of work are you specifically doing right now in the COVID-19 pandemic? Are you working with COVID patients or?
So as a float nurse, every night I go to a different floor. So I have gone, we have a COVID rule out floor. I have gone there a few times. I help out on the medical surgical with, all the rest of the hospital patients. And then lately I've been out doing a lot of ER screening, which is when I sit inside the entrance of the ER and I have to screen all of the patients for COVID symptoms. So if you come in with, the three main symptoms, a fever, cough, shortness of breath, I then have to send those patients to a secure area for them to be ruled out for COVID.
Now, I just spoke with your husband yesterday, who's also a nurse, and your husband disclosed that he recently tested positive for COVID-19. Have you been tested for COVID-19?
I have not been tested, no.
Okay. Does the hospital that you work for know that your husband tested positive?
Yeah, so I called them and spoke with them yesterday. They won't test me. They probably wouldn't test me anyways, but I haven't had any symptoms.
Okay.
So at this point, there's no need to test me.
Okay, and your husband and you are living in the same house?
That is correct.
Okay. And will you continue to work with patients until you show symptoms?
Yes, I will. So I have to monitor for any symptoms. I have to do twice a day temperature check, and I have to send that to my employee health, and then I just have to wear a mask at all times when in the hospital.
Okay. Tell us a little bit about what it's like in the hospital. What are the crowds like? Are you experiencing more patients than usual or the same amount, or what's that like?
So I don't want to say it's not as busy because it's a different kind of busy. So we don't have any surgeries and, any planned procedures like that. But we still have, the normal patients that come in with their COPD, their heart attacks, their strokes. So we're taking care of all of them. It's just in like one floor, one area. So it's definitely much busier in like, our med surg and our cardiac because there's less floors and there's less nursing staff. And then for the COVID patients that come in, the acuity or severity of how sick they are is definitely much worse. So we have less patients, I guess you could say, but they're more in depth.
Okay. So the fewer patients, but their medical cares are more complex wow. And how about personal protective equipment? Tell us about that. What do you have for personal protective equipment?
So for personal protective equipment, it depends on the floor you work on. So every nurse has to wear, actually every person in the hospital has to wear a mask the entire time they're in the hospital. So that was implemented last Friday, I believe. And we all got one mask and one paper bag to keep the mask in. And this mask we have to keep for essentially as long as possible until it starts to deteriorate. So usually about a week and a half. And then we're supposed to keep that paper bag in our locker or in our locker room.
Wow. Is that an N95 mask or is that just like a little surgical mask?
No, it's just your regular surgical mask.
So they're giving you one surgical mask for the week and a brown paper bag to keep it in?
Correct.
Yep.
And if you have a locker.
Sorry, you'd actually told me about that before we did this interview, and I'd asked you to bring yours in from the car. Could we see that?
Yep. So here, because I'm a float nurse, I don't have an actual locker anywhere to keep it. So I have in here is my mask that I've used for 2 shifts. I have one more shift this week. So it's inside of here, inside the paper bag. And then my manager told me since I don't have a locker to keep it in, I can just keep it in this patient belongings bag in my car.
Okay. Wow. So literally you get one surgical mask and a brown paper lunch bag to keep it in.
Yeah. And
Is
when you
that
need a new mask, you have to ask the supervisor, and that's, not, they have to go and search for the mask, which is usually like in their office locked away.
Mhm. Now, I know that you've worked at several hospitals in the Worcester and Boston area. Have you talked to any nurses who are working at any of the COVID treatment centers in Worcester or Boston?
Yes, I actually have one friend that works in a Worcester hospital, and she was talking to me. We were explaining, what everyone their PPE is and what their rules and regulations are. So for mask wise, theirs is they get one mask a shift, but their gowns, which are one-time use gowns, they are reusing them. So in her shower room where they used to wash their patients, on one side of the wall they have the rule out patients. There's a whole bunch of gowns that they each get one gown per shift, and at the end of their shift they put them back and they're cleaned. And on the other side of the shower room is all the positive COVID patients gowns, and they get one gown per shift that they have to take on and off.
Wow. So what do you think the likelihood is that you or the other nurses that you're working with are going to at some point experience symptoms and have this disease? Or
I
this,
think that it's pretty good. I think that, I mean, especially, having my husband have it, there's an even higher chance that I'll get it. And for the other nurses, so like we have the proper PPE, but we just we're not using it properly. So I think because of that, that increases everyone's risk of getting it, and the length of time that we spend with the patients, which it sounds horrible, but the more time you spend with a COVID patient, the greater your risk is of getting COVID.
Mhm. Now, you were also telling me a little bit earlier about at one of the Worcester hospitals, they're having some issues already with allocating ventilators and getting ventilators to the people who need them. Can you tell me a little bit about that?
So actually last night, one of my friends was telling me a story about how she had an older gentleman that was positive for COVID, and he wasn't doing so well, and he made the decision that he didn't want to be intubated. He would rather change his code status to a DNR, DNI, which do not resuscitate, do not intubate, so that he could pass easier. Um, and so the nurse was there with him. And then when the nurse left the room and was talking to the doctor informed her that even if he did choose to be intubated, they probably wouldn't do that because the number of ventilators they had left wasn't high enough. And they would give that to a younger, like 30, 40-year-old patient over this patient.
Wow. So even if the older patient did want the ventilator, the doctor was saying that they would make a choice to give it to someone younger.
Yes.
And do you know, is there any process by which those decisions are made, or is it up to each doctor or team of doctors on the floor if this situation arises?
I'm not exactly sure. I haven't really heard anything about that. But what I would gather would be, age is a big number, like, and if they'll be able to tolerate the intubation. If there's any other comorbidities, it mostly comes down to like survival rate after being intubated.
Okay. And I think we also talked a little bit yesterday or maybe earlier today about the fact that Senator Michael Moore from Millbury in the Worcester area of Massachusetts is presenting a bill to the state legislature for emergency hazard benefits for nurses, doctors, firefighters, police, corrections officers, different people who are really in the front lines during this pandemic to ensure that they have benefits and good benefits if they do contract the disease and are disabled for a period of time or even worse. What do you think about that? Is that helpful? Is that something that's important to you?
I think that's very helpful, especially if, we have a lot of nurses out there that are single parents that have, a lot of other responsibilities. So if they contract this virus, they no longer have a means to live. So if they have to use, their paid time off, they can run out of it and not get paid. They won't be able to pay their bills. Or like with my husband and I situation, if I were to contract it and we were both out of work, that'd be no income for us either.
Mm,
And yes, this is our job, but we're not being supplied the equipment properly. So we deserve some compensation for that.
yeah. Now, for those of us who are kind of learning more about what's happening with you guys on the front lines from the news. A lot of the news looks a little bit bleak and a little discouraging, but I would imagine in a situation like yours, you're probably seeing some things that are very hopeful or very inspiring. Can you tell us something that you've seen or that you've personally experienced that's going to stick with you as something that you remember as being really positive, something that could really make people feel uplifted?
So with all the, with everything going on, and like I said, like they're closing down like surgeries and everything like that. So like our OR nurses, our PACU nurses, they're not working in their trained field. So they are helping on the floors, in the ER. The ICUs are going to be so busy, in the next few weeks with patients that are intubated. So floor nurses are learning, how to use ventilators so that they can go down and help in the ICU. So like the teamwork, nursing is a big, huge family. It doesn't matter what, part of the hospital you work in, what hospital you work in, like if you're a nurse, your family, and we're willing to help each other out, like no matter what's going on. So that's great. And I believe last week or the week before, we did have a patient recover from COVID that was in the ICU and was discharged home. So that's, we see all these numbers of the deaths and everything like that, but there are people that are recovering and that are able to either go home or go to a rehab facility.
That's amazing. That really is uplifting. Tell me, why do you think nurses are doing this? They're exposing themselves to so much risk, and I know, like you said, some of them are single parents or even any parents. Some of them are older or have pre-existing conditions, and everybody I'm talking to is just telling me so many stories about how people are volunteering to work with COVID patients. They're learning new specialties. They're coming in for extra shifts. Why are nurses? What is it about nurses? Why are you guys all doing this?
I think deep down, even though it's scary and, you see a lot of us like being angry about the way things are being run, deep down, we just want to take care of people. Like it's in our bones, it's in our blood. Like we want to take care of people. We love seeing people get better. So when the time comes to help, no matter what the situation is, like that's what we want to do. We just want to take care of people.
Mm. Well, hopefully, all the people out there watching will take care of you and try to support Senator Moore's bill. Is there anything else that you think that we should know, or anything that you want to tell us about what's happening or what we can do to support the nurses and the amazing work that you all are doing?
Stay home. I know it's cliche, everyone says it, but stay home if you don't need to be out, because they're finding that, you can be asymptomatic, show no symptoms at all, and you can still be a carrier. Like I technically could still be a carrier of the virus, even though I don't show any symptoms. And if, I start going out, I can pass that along to everyone. And we're also finding out that the symptoms are different for everyone. They're not the same three that we hear. So if you are concerned that you have, COVID, call your primary and they can have you talk to the hotline, and they can see if you are a patient. And to help out nurses, I think just tell them thank you. You see a nurse out in public, they probably either are going into a shift that they know is not going to be a very good shift, or they just came home from a shift that's not good, and just say thank you and be nice. And maybe buy them a coffee, because we all love coffee.
Coffee. That's
Coffee.
something we can do.
Coffee and chocolate. Nurses love coffee and chocolate.
All right, that's amazing. And then this last question is probably the most important question of the interview.
Okay.
Do you think that Carol Baskin killed her husband?
Oh, she totally killed her husband and fed him to all those tigers. Yes, she did.
Well, listen, on behalf of me personally and everyone out there, thank you so much for your sacrifices and your husband's sacrifices. We just can't say enough how much we appreciate it. And you stay safe and healthy out there, okay?
Thank you very much.
And if there's anything that anybody can do to help you or your husband personally, let us know. We'd be happy to post it on our Facebook page, and I'm sure there's lots of people who'd love to show you guys some love and appreciation, okay?
Awesome. Thank you very much.
Thanks, Jill. All right, bye-bye.